Going to introduce our next session. Please help me welcome Dr. Ritchie and Susan Sanford. They're perfect for anyone who's curious about medical school or thinking about a career in psychiatry. They both work at Pine Rest, and Dr. Ritchie is the psychiatry resident, and Susan Sanford is the manager of physician and AAP recruitment. They're going to share a little bit about what it takes to become a psychiatrist, and we're going to be doing a live QA. So please feel free to drop your questions in the chat. I have a couple prepared, but I'm sure that they would love to hear from you. So with that, welcome to our session. And we'll begin, Dr. Ritchie, with, can you tell everyone a little bit about yourself and how you came into your position?
Yeah, so I'm Manasvi. I am a child and adolescent psychiatry fellow. That means that, we did undergrad, we did medical school, we did residency, and now we're in fellowship. And I enjoy working with adults and kids, and yeah.
Great. Can you tell us about how you become a psychiatrist? We had a session this morning talking about how to become a psychologist, and I know that oftentimes those two roles can be confused and interchanged. So can you give us a little bit of details about that?
Absolutely. Those roles are interchanged often. I think psychologists and psychiatrists work very much in parallel. We're really successful when we work together. The pathway to being a psychiatrist is a medical pathway. So we go to medical school, you do your pre-med undergraduate requirements, you apply to medical school, you take the MCAT, and you do all of medical school. In medical school, that's when you pick your specialty, of which one of them would be psychiatry. And so a lot of us, me included, didn't know that we were going to go into mental health, going into the medicine field. But I think it's a really engaging and great field that kind of pulls you in the more you get to know it. And then after medical school, when you graduate, you match into residency. In order to practice, you have to do residency training in order to take your boards and become board certified. So then for psychiatry, it's 4 years of residency. If you want to do an additional fellowship training, which is what I'm doing, that would be an additional year.
Fabulous. No, thank you for going through that. Yeah, it can be a misconception between the two. So I appreciate you providing those insights, and welcome, Susan. I would love to learn what a typical day looks like for the two of you. Susan, if you'd like to start us off.
So my day is quite different than Dr. Ritchie's because I'm not a clinician. So I do recruitment in the medical field. I work specifically for Pine Rest. So I am working with individuals that are at the end of their training and education. So my day consists of a lot of phone conversations with individuals like Dr. Ritchie that are nearing the completion of their training program and looking at job exploration. So one of the things that I do is I have a lot of in-depth conversation with psychiatry residents and fellows as they're completing training to find out what area that they would like to work in. Dr. DeBay kind of planted some seeds in psychiatry that are very common, like working in an inpatient hospital. She referred to outpatient clinic. She referred to partial hospitalization, which is a different level of care for psychiatrists where patients are seen during the day, kind of like a school day where you're not ill enough to be admitted to the hospital to stay overnight, but you need a little bit more care than someone who's just seeing an outpatient psychiatrist maybe on a monthly basis. Working in a psychiatric urgent care or a crisis stabilization unit where you're seeing patients when they're in crisis and needing to get to the next level of care. So my day is spent talking to trainees, talking to physicians who have already been practicing about their career interest and where they might find a good career fit with Pine Rest.
Awesome. Thank you so much, Susan. Dr. Ritchie, how does your day work a little bit differently on that clinical aspect?
Yeah, so in training, in residency, and in fellowship, we kind of see a little bit of everything because the goal is by the time you leave training, you want to be comfortable and feeling confident in all of these different fields. So we do several months of inpatient training where it's that higher level acuity of care where patients can't keep themselves safe or there's risk of harming others. With adults, we run into a lot of those concerns, particularly with more of the severe persistent mental illnesses. With kids, it's often more the risk of hurting themselves. And then we also work in the outpatient setting with longitudinal care, following a patient through years of care and getting to know their families, getting to put together the full picture of what's going on and building that lasting relationship. That's been really exciting too. Like Susan mentioned, we work in the partial hospital program. We get exposure to emergency psychiatry, which would be that acute crisis stabilization piece of things. We do something called consult liaison psychiatry as well throughout training. That is really in combination with the medical specialties. For example, if a patient has really significant diabetes, but they also have mood disorders, how those diagnoses kind of interlap and work together. We are trained in neurology as well. Psychiatry and neurology kind of came from the same field. So we do a lot of cross-training. The neurologists get trained in psychiatry. We train in neurology because it's all of the brain, and we want to make sure that we're not missing anything either. So really, I think training is just an opportunity to become really well-rounded experts in our field, and that's why the process is so long and so thorough.
Absolutely. We definitely want to make sure that everyone has the experience and breadth of knowledge they need, because we know that these needs can be quite complex. We do have a question in the chat, which may be suited for yourself, Susan. They're wanting to know, they're trying to become a psychologist and an art therapist. And what would be a good stepping stone as kind of that recruiter kind of role? I know that this is more psychiatry focused, but is there kind of those stepping stone pieces within Pine Rest, and how might that student access those resources?
That is a great question. I can see it in the chat right now, and I have to plead ignorance because I work specifically with psychiatrists, psychiatric mental health nurse practitioners, and physician assistants. So I don't know if Dr. Ritchie would be able to add to that, but that might be more appropriate. I think there was another session, and there's an upcoming session specifically about psychologists. So unfortunately, I can't answer that one.
No worries. Dr. Ritchie, any insights to put you on the spot? But if not, that's all right.
I'm not a psychologist, but I know that, psychology is also something that you need to do an undergraduate degree before you get into that field as well. So I think the best place to start would just be planning some clinical experiences, volunteering in the field, building those connections, getting to really see the day-to-day, maybe working in schools, maybe working with a psychologist before we get some of that exposure might be helpful.
Fantastic. Thank you. And that kind of leads into another question that I had for the two of you, which is resources and experiences that you would recommend for students who are exploring these kinds of careers, specifically within the psychiatry field. But how does someone go about testing the waters to make sure that something like this is going to be a good fit for them?
I can talk a little bit about what we look for. So again, I'm on the outgoing end when somebody's in training, but when we interview candidates for positions in psychiatry at Pine Rest, we're always looking at, what was their journey and what kind of prompted them to explore this. And I'm always pleasantly surprised about the number of personal stories that we get where somebody was touched by something that happened in their personal life, a family, a close family friend. I'm also always hearing stories about how they were exposed to mental health from maybe a volunteer standpoint. For example, just recently, I did some tours of the Pine Rest campus with students that are going through the Kent County Technical Center. It was a great opportunity for individuals to come through and consider phlebotomy positions in our laboratory. And those were students that weren't particularly interested in mental health, but they were exploring careers in healthcare. But I think it was a great opportunity for them to come on campus, tour our facility, and learn about mental health careers that maybe they hadn't thought about. So I think exploring mental health from a volunteer perspective, maybe looking at a position that you can do while you're in high school. I think we also have a lot of individuals that aren't sure if they want to go into psychiatry. So they, right out of high school, they might work as a psych tech in a mental health facility that'll expose them to different careers, whether it's psychiatry, social work, nursing, psych NP positions. And I guess the other one that I oftentimes see on resumes are individuals that maybe worked in a non-clinical role but they maybe, for example, maybe they worked as a scribe in a medical office. And so they were in the examination room with physicians and learning more about interviewing patients and caring for patients, which sparks their interest in mental health.
No, that's great. Thank you. And Dr. Ritchie, since you've gone through this, what kind of experiences did you personally try to get in order to figure out whether this was going to be the path for yourself?
Yeah, I mean, like I said, a lot of people go into medical school not knowing what specialty they're going to do. I wasn't sure I was going to go into psychiatry. I had thought about, emergency medicine or OBGYN. And so I think what is most helpful is if you're interested in mental health for sure, then I think we need to decide what aspect of mental health we want to go into. If we want to do psychology or therapy or the medical side of things. And then if you're in the medical field, I think just exposure to psychiatry, like Susan was saying, whether that is within the rotation, whether that's volunteer experiences, I think every clinical experience is valuable. And I think programs will look at that for training. I know employers care about different clinical experiences, and just the more comfort and confidence you can bring into it, I think is helpful.
Alicia, I think it might be helpful just to expand on a couple of things that Dr. Ritchie has said. We use a lot of terms in our industry that maybe aren't familiar to high school students, and like, what does that mean? So Dr. Ritchie was talking about her residency and her fellowship program. So she came to Pine Rest to do a general psychiatry residency. And after 3 years, she then transitioned into a child and adolescent fellowship. So 5 total years at Pine Rest. During that residency and fellowship, the trainees go through what we call rotations. And rotations are, to put it maybe in a high schooler's term, like internships in different clinical areas. So during her training, she's being exposed to, like I said, inpatient, outpatient, consultative liaison, all these areas. And like in medical school, she might not have known that she wanted to do psychiatry. Oftentimes when you want to do psychiatry, but what the residency and fellowship allows you to do is also explore where your specific interest lies. So on the receiving end, oftentimes I'm looking at residents and fellows that when they started residency, they weren't sure, but maybe by their 3rd or 4th year of training, they're very specific now. If I want to work with children, I want to work in a high acuity setting like an inpatient hospital, or I really want to work in the outpatient. So I feel like having that initial interest is great, but I don't oftentimes talk to residents and fellows that know exactly what they want to do through this whole path. Because again, the path is long. It's 4 years of undergraduate. It's 4 years of medical school. It's a residency that's minimally 4 years, and then oftentimes some fellowship training that lasts another year. So I feel like I always call it a journey, an educational and training journey, where oftentimes individuals will start thinking they want one thing, and by the time they finish their journey and look into the job market, they're looking for something quite different.
And to Susan's point, I think that's why it's so helpful to keep an open mind and get all of the clinical experiences that you can get. I think if you're looking into being in the medical side of mental health, then you start off broad. You go to medical school. Every specialty goes to medical school. And continuing to expose yourself to all different types of things is just the most helpful thing to do, because you don't really narrow it down until much further in the process.
And I'll add one more thing to Dr. Ritchie. I hope this is a little bit more back and forth. The other thing, and I don't know if it was abundantly clear from the first 2 presentations, which I had the honor of listening to, one of the biggest differences between what Dr. Ritchie does or even Dr. Dubay does as a psychiatric mental health nurse practitioner is they have the medical piece. So they do medical management. A psychologist, a psychiatric nurse can't manage medicines, but physicians that go through medical school or a nurse who has gone on for that additional nurse practitioner training and psychiatric mental health nurse practitioner manage medications. That's one of the biggest distinctions in my mind as to the difference between what she does, what Dr. Dubay does versus a psychologist.
No, that's perfect. And thank you for that clarification. I know that just even with a basic understanding of the mental health roles, they can be kind of overlapping in some aspects. So having that kind of distinction between the different roles is very helpful for students. So when you're talking about the pathway to becoming a psychiatrist, it is long. It is a lot of schooling. So what are some supports that you both know of that would help somebody who's like, okay, I want to do this. I want to try to explore this, but I have no idea how to get from point A to point B. What resources, even within the Pine Rest community, are there available for students who may be wanting to go to school and still work, or if you know of any opportunities and scholarships, those kind of components that would help students?
I think probably Susan can talk more about if there's any scholarships or any opportunities like that. I think the thing that I found most helpful going through the process, because it's a long process and everyone loses the spirit of it sometimes. But I think to kind of get through, the most important thing is mentorship and, being acquainted with someone that has gone through the process, knows how long and arduous it is, and being able to feel seen and heard within that experience, and also reminded that we want to get to the end goal. That is our goal. And I think, in every field and in every stage of training, just finding that balance of the things that bring you joy and fill you up while you're investing in your future.
I think there's a lot of resources available, but you have to tap into them very early. So during high school, you could be meeting with your high school counselor. I know there's lots of opportunities in our own state, like with Michigan State University College of Osteopathic Medicine. They have a program called Osteo Champs. I know there, Alicia, where you work with the Michigan Health Council, there's HOSA, Health Occupation Students of America. There's lots of opportunities very early on to start kind of scratching that itch of, is a career in medicine appropriate for me, and what might be appropriate? You just have to tap into those and engage in conversations so you can decide, am I in for the long haul? I'll be honest with you, I work with physicians who change their minds during their training path. I'll give an example. Just last year, we had a child and adolescent that went through our training program, join us. He was a nurse first. He was an emergency medicine nurse for 9 years, then decided to go back to medicine. So sometimes there's what we call a non-traditional path, where someone's not quite sure they want to be a psychiatrist, but they know they want to work in the health field, and they find that path a little bit later. We have many individuals at Pine Rest that actually has started as a psych tech. So psych tech is something you don't need you don't need education beyond high school. So sometimes folks get out of high school and they become a psych tech for a year or two while they're going to undergraduate or trying to figure out if they want a career in mental health. As far as support, again, I think it's tapping on advisors and mentors. I want to talk a second about the support that we provide for our trainees and also our new young physicians that enter into Pine Rest. I recruit, right? But we call recruitment and retention, we call it recruitention, because we want individuals to feel supported even when they're done with education and training. That transition into practice after being a student or a learner for so long is quite a big transition. So we even have mentorship for new young physicians who are attending physicians who have already completed their training path. And to speak a little bit to scholarships, they're out there, they exist. You have to look early. What exists for undergraduate is very different than what may or may not exist for medical school. There are even some small things that you could tap into while you're in residency. And then after training, many employers offer recruitment incentives. They're not scholarships, but there's some financial resources that we offer to help repay loans. There's state programs. The Michigan State Loan Repayment Program is a program that can help you. You incur the debt and then you can get that later. So there are resources available. You just have to tap into them early and along each stage of training.
No, that's great. Thank you for sharing those. I love the piece about mentorship, and I love that Pine Rest specifically has, that focus on making sure that there's a mentor there for when folks have reached kind of that employment section of their career path. But Dr. Ritchie, you talked about finding mentorship while you're still completing school. So is there a formal way to access those kind of mentors, or is that just finding someone who's maybe in the year ahead of you in your medical school program? What does that look like?
Yeah, I don't I don't know of any formal ways. I know some medical schools do have more formal mentor setups. And I know our residency program at Pine Rest has a mentorship where you're set up with someone a couple years ahead of you in training. So there are some formal methods to do it. I think the ways that have felt most helpful and natural and organic to me have been to find those connections where you can connect with someone as a person and you can feel like someone is invested in you and cares about you and also will be truthful with you about how the process is working. And I think that is really the best way to do things. I think a formal program is a great place to start, but I find that the most helpful mentorships come more organically.
Absolutely. No, thank you for sharing that. So going on to the side of kind of that recruitment and if someone's deciding with whether or not they may be a good fit. Susan, can you speak to some of the characteristics that make someone successful in one of these roles? And then to kind of add on to that, how might someone set themselves apart if they're submitting a resume to you and they want to join your team? What are you looking for? How can students start to kind of build those pieces up so that they can make themselves stand out?
Perfect. This seems really remedial, but I have to share it. I think the biggest thing that probably sets applicants apart in my world is writing a cover letter. I think sometimes through this educational and this long journey, we sometimes forget that now you're applying for your first professional job. So in addition to having a resume, or as we call it in our field, curriculum vitae, a CV, it's really important to put together a cover letter. And things that you highlight in the cover letter are what inspired you to get into psychiatry, and what are you looking to do? So in every interview, we are always asking our applicants, what's inspired you? Why do you want to work in mental health? One of the resounding themes that we see are psychiatrists are very good listeners, right? So they always are interested in the story. They're always interested in what we call collateral information. And collateral information is not just talking to the patient, but finding out about their environment and their background that can help lend itself to diagnosis and treatment of patients, because sometimes they're not in the best position to give you all the information. We also look for applicants that are, I don't know if I should say this way, but not just getting into a career because of what they can earn. I know that, earning potential and repaying financial debt is a really important thing, but our goal is to find folks that really want to do the care and not just focus on the earning potential. I think some of the other things that we test on when we're doing interviews are the relationship. We work in a field that is very relationship. It's not transactional. It's very longitudinal. Oftentimes you're dealing, particularly in the outpatient environment, you're dealing with patients for a very long period of time versus someone who might be working in an emergency department where it's very episodic. So those are some of the things that we look for. We also look for extracurricular, and I think if I could encourage high school students to do something, although time is tight sometimes, get involved in extracurricular. Oftentimes when I'm reviewing CVs, I see CVs for folks that were involved in things like homelessness, maybe working in a homeless shelter, maybe environments that exposes them to some of the difficulties in mental health. It is very difficult. I get asked all the time, can I volunteer at Pine Rest? We have limited volunteer opportunities at Pine Rest because of the environment. We are very much into keeping patients safe and protecting their privacy. So we have limited volunteer opportunities for someone to come to our hospital and work versus a medical hospital where you could be a transporter or do something like that. But there's lots of ways that you can volunteer and get involved in your community in ways that shows your support and learning and interested in learning in mental health.
That's perfect. Thank you so much. I know that we're coming up on time here, so I'll just finish off with one question, kind of wrapping up for the two of you. And that is, if there's one piece of advice that you would kind of finish off or a final thought that you would like to leave with the students and attendees today, what would that be?
I have a couple thoughts. One is that I know Susan talked about earning potential. I also hear from a lot of people considering medicine that the process feels very daunting in terms of student loans and the amount of input you're putting into it. And, I am in the throes of that myself, but I feel that sometimes I hear people say, because of that, I didn't go to medical school and I went into X, Y, or Z instead. And I just want to encourage people to think of it as an investment that will pay off. And we know that, most doctors have student loans and they don't often struggle too much in paying them back. And so just a general PSA to follow your interests, and things will work out, even if it seems really scary in the process of things.
Thank you. Susan?
I think my advice would be a lifelong learner. Even though Dr. Ritchie is completing her training next year and she will be progressing and transitioning into practice, I think in this field, you have to consider yourself as never done learning. In our field, we call it continuing medical education. It is a requirement. You have to do it for licensure. You have to continue to be board certified. But I think in psychiatry in general, you just have to stay curious. So I think I would recommend that students just be curious, ask questions, take every opportunity to ask questions of those that surrounding, whether it's a school nurse, a school counselor, maybe there's a student in your school who their parent is a physician. Just be curious and ask really good questions that can help you kind of sift through all the information out there and decide if that's what you want to do.
Fabulous. Thank you both so much for joining us today. Oh, go ahead, Dr. Ritchie.
I was just going to say, in addition to being curious, just never feel like any field or any direction is closed off to you. And there's always going to be opportunities. And I think the more interested you are and the more you seek those opportunities out, I think they're available.
That's perfect. Great words to end on. I couldn't have ended it better. If you have any questions for Susan or Dr. Ritchie, please drop them in the chat, or we might be able to connect you after the fact. Just thank you both so much for joining us today. Susan, you had one last thought?
It wasn't a thought. I wanted to address a question that popped up in the chat earlier, but it said Hannah had asked a question. She wants to pursue becoming an ABA. So she was asking about opportunities and how do you look for jobs? We hire ABAs, so obviously Pine Rest would be a good place, but ABAs can work in a variety of places: outpatient clinics, hospitals, residential areas, schools, home settings. So as far as a job search, go to potential employers, and those would be the folks. And then ABAs obviously are working with the autistic, behavioral disorders, developmental. So those environments that take care of patients like that would be the first place you'd start your job search.
Fabulous. Thank you for that. I didn't have an answer, so I'm glad that someone had that and was able to share that. So thank you both again so much. And